I do apologize for the delay, and we've got a few people, I think, online. We got some new people here. It's good to see so many people out here, and our telecom folks. We love that. They were trying to deal with us from remote, and that was a little bit tough last year. So I felt it was important with the new members that we've got and the start of a new year that we get a fresh update and review on what the 988 legislation is about, what the numbers are, kind of get all your questions answered. It's not something we're working today or passing out today, but I want everyone to be informed and understand what's happening. So I believe the only person I have on my agenda is Mr. Andy Brown from the Department of KDADS. Welcome to committee, Andy.
Thank you, Chairwoman Landwehr and members of the committee. I'm very happy to be here today at the start of the session to talk about one of my favorite subjects, 988. So, and I'll go through my written testimony here pretty quick and take questions. But we also included a 60-page document that is our plan for implementing 988 here in the state of Kansas. This is a final draft version, so it's not the final, but it is very close. And we will be submitting this for a final review here very soon. But I wanted you guys to have a chance to look at it. And if there's time and we want to go over any of that, we certainly can, but it's there for your reference. So,
All your testimonies online.
It's got to be online.
Dave?
It's on your file. Dave can.
It's on the S drive.
It's on your S drive of your computer because it didn't get onto the website. Dave had some extra duties this morning, and that can all be blamed on the chair, so. This won't be the last time we have this discussion and stuff, and we'll make sure that everything is presented out. It's just been a rough start this week, so. And Dave will be getting that up here so that those of you that are wanting to actually see it online, et cetera, Dave will have that up here shortly, so it won't take too long. So Andy, if you'll go ahead and start, and
sure.
We'd appreciate it.
All right. So again, thank you for allowing me the opportunity to come here and speak today. So KDADS, this 988 project is an ongoing project at KDADS, and all across the country, this is being implemented on July 16th of 2022. So we've got about a 6-month window to implement, and we recently had the opportunity to apply for some federal funding that will assist with getting some of the call centers ready in terms of staffing. And we did receive some state general fund dollars last year that will also help with call center staffing. But this ongoing effort is important because we still haven't passed any 988 legislation in the state. And so this session would be our opportunity to do that prior to the implementation of the 988 program nationwide. So This has been a recommendation to fund the National Suicide Prevention Lifeline in the state of Kansas in multiple reports and studies, and multiple task forces and work groups have made this recommendation. Kansas has been working to develop suicide prevention infrastructure in our state that'll support the implementation of this program and also help prepare our NSPL contact centers for their transition to the new number. We're supportive of the 988 law, and we want to see 988 implemented well here in Kansas. We feel like it's necessary to appropriately resource in order to do that. So the grant that we had for planning will be coming to end in a few weeks. We've completed our planning process. Again, that draft of the implementation plan is available to you to review. Right now, based on the information that we've collected and the advice that we've gotten from consultants, as well as subject matter experts at the national level, we have a $3 million gap between where we are today and where we want to be in terms of funding for the 988 contact centers. So steps that we've taken this year is that we have hired a 988 project coordinator. We had one that worked with us while we were doing the planning stages of the planning grant that was grant funded. And we've moved on to an ARPA-funded position that will begin with the implementation phase on February 7th. So we are now, we've put out the $3 million that was awarded by the legislature and the governor's office into the budget for last year to the contact centers. Those contact centers are ComCare down in Wichita, Johnson County Community Mental Health Center, in Johnson County, and then Kansas Suicide Prevention Headquarters, which is our statewide contact center. We've also contracted with Health Source Information Solutions in order to be a statewide backup center. They are currently working through the process of becoming an NSPL certified center and getting their accreditation. Once they're online, I believe that we'll be hopefully operational at about a 90% in-state answer rate. Our planning grant requirements and the grant we had before that to help us get to increased capacity with the call centers, we were at about 60% in-state answer rate at the time that we applied for that. And just recently, as of last month, we have achieved an 80% in-state answer rate. So that's a 20% increase in, or not 20% increase, but it's an increase of 20% in our in-state answer rate. So we're very proud of that fact, but we still have a ways to go. And as you're aware, there's a significant increase in volume expected because 988 will be an easier number to remember than the 800 number that they currently have to call. And it's also expected that there will be quite a bit of publicity and promotion of the 988 number to increase its awareness of the public conscience. So we're currently staged, right? We're well poised to be successful in this at this state and time, but we do feel like we need additional resources in order to fulfill that mission. So notice was recently given to KDADs and other states that SAMHSA is going to put out this federal ARPA grant for hiring workforce for 988 contact centers. So based on that formula, SAMHSA will award Kansas $935,937 for 2 years. So those funds will be available for us to disperse at a later date. 85% of that funding is a direct pass-through to the contact centers for hiring staff. Our expectation will be that key performance indicators will be reported, and that the primary goal for receiving those funds will be to reach the 90% in-state answer rate by June of '22. So the final date for telecoms across the country to implement the switch to 988 is early in July 2022. July 16th, I believe, is the exact date. And many of the leading telecoms have already enabled 988 for their customers, but the country hasn't started, or SAMHSA hasn't started broadcasting that to the public yet. But right now, a lot of companies are already in a position where they've made this change. So we do anticipate that there will be an increase in call volume based on the knowledge that we've gained. And according to Vibrant's projections, we will need an additional $5,934,597 to meet that demand. So that's their phone calls, that's their text messages, and that's their chat component. So right now, with the $3 million of state general funds, we've got about a $3 million gap between that anticipated projected cost and where we are today. So Vibrant, which runs the NSPL for SAMHSA, has offered 5 potential funding solutions for states to consider. Kansas' approach in our implementation plan is that we would like to see a 988 fee from telecom users. That is outlined in House Bill 2281, and depending on the final fee amount, could raise up to $17 million for 988 integrated crisis care services. We also suggest direct engagement with the state legislative budget committees for 988 specific funding, potentially as much as the $6 million SGF that's needed for the telecoms. And we're also recommending partnerships with stakeholder groups that may have the ability to contribute to 988 resources. And we do need to point out that KDADS itself can't fundraise, and neither can ComCare or Johnson County, because those are also government entities. So we recently published our new 2020 to 2025 state suicide prevention plan. This plan highlights the need for state infrastructure development around suicide prevention. One of the main components that's needed is an integrated crisis care service delivery system, and that really begins with 988 as the front door. So when somebody's in a crisis, they can make that 988 phone call. Once that 988 operator receives the call, they're able to work with that individual to see if they can resolve the crisis. If they're not able to, the 988 operator can facilitate a dispatch for mobile crisis. The mobile crisis team would respond to that individual in the community. If there's a need for further intervention beyond that, that individual could be taken to a crisis stabilization unit or a crisis intervention center where they could be admitted voluntarily. If there's additional need for acute care, they could be screened for hospitalization at the state hospital or one of the state institutional alternative hospitals that's near them. And kind of as a last resort, there could be an involuntary admission either to a crisis intervention center or to a state hospital if the person's not willing to go voluntarily. But that's what an integrated crisis system looks like, right? Is that there's one front door, everybody gets served at the level of care that they need to be served at, and nobody gets lost in the weeds. So this is our opportunity to really think about how we want to approach that here in Kansas. I feel like the plan that we've submitted is a good plan. We continue to work with national and federal resources in order to try to expand our understanding of how to build out these systems. And I'm confident that we have the resources that we need to do that as long as we can fund it adequately. So 988 is really a vital component to that effort for modernizing our behavioral health system. It's a high recommendation from the Mental Health Modernization and Reform Committee, and we feel like it's an important step for us at KDADS. Additionally, KDADS and the governor's office are supportive of that work and creating a robust continuum of care. So in addition to the costs that are associated with the crisis care system, we also need adequate funding for our outpatient services, our CCBHCs, and many of the other steps that this committee and other committees in the legislature have taken in order to help us move forward with modernization here in the state. The federal act that enables 988 nationwide does not provide any federal funding to states to support it, but it does instead establish the authority of states to assess 988 fees on telephone services to fund the 988 programming. So we take no specific position on the funding mechanism that's incorporated within the 988 bill, and we support the legislative policy decisions in discerning how 988 should best be funded in Kansas and by Kansans. However, the federal authority provided to Kansas over the use of 988 fees is included in the testimony. And there's a section of that I'll read, which is that the fee or charge collected under the subsection shall only be imposed, collected, and used to pay expenses that a state is expected to incur that are reasonably attributed to personnel and the provision of acute mental health, crisis outreach, and stabilization services by directly responding to the 988 National Suicide Prevention and Mental Health Crisis Hotline. I think that language is pretty plain. I think it clearly explains that we're allowed to use these funds to cover crisis care for individuals that contact the 988 phone number. That would include the dispatch of those mobile crisis teams. It would include the placement of them in crisis stabilization units or crisis intervention centers. And it would include potentially the cost of their hospitalization. KDADS is making significant strides in trying to improve our community-based services so that we can prevent these crises from occurring in the first place. We're working hard to try to establish a system that prevents hospitalizations, that serves people at the appropriate level of care in their communities, helps them find employment, helps them find housing, help keep them stable, out of trouble with law enforcement, out of trouble with the courts, right? But all of that work involves us making sure that we have a system that's robust enough to treat people at the time that they need treatment. And that's what we're really asking for today. So thank you for allowing me to provide testimony on this important issue, and I'll stand for questions.
I'm sure we're going to have plenty. One of them, and I was flipping through the large report, which I will read later.
Yep.
The one chart, well, it's not really a chart, but the one page that we were working with last year, and I just don't have it down here in my file, was where we had broke out, if we had the 50 cents, what would that be spent on?
Sure.
Kind of like our projections. And I think that's important for us to have that before us
Yeah.
so that everyone understands what is that total. Because that 50 cents raises what?
We think 17.5 million or so.
Okay. So it's important for people to understand why it is that we're doing what we're doing. The other thing is the couple questions I have, and then I'll open it up, committee, is you mentioned a federal grant.
Mm-hmm.
What's that?
Yeah, so that is
And how
hot off
much?
the press.
Huh?
It's hot off the press.
How much?
It's 600 and,
I didn't see it
yeah,
in here.
sorry, it's in there. It's, let me look. $935,937 over 2 years.
Okay, I took that as being the SAMHSA, so that's what you're referring to as the federal, is
Yep.
that SAMHSA money?
Yep.
Okay.
Yep.
And then you mentioned ARPA.
Yeah, same grant. It's ARPA funding from the American Rescue Plan, which is why it's limited to workforce.
Okay, see, I took that as the potential of 3 separate grants, so, okay.
And it's all just one.
You need to be clear for me, Andy. You know how I am. All right, committee, are there questions? Representative Blex.
Thank you, Madam Chair. As I recall last year when we talked about this 50 cents, it was at least under my understanding, so clarify for me that 50 cents would go to the response center, the telephone charges, and now are you kind of saying that that's going to be used to pay for a lot more other things, or?
Yeah, so let me go ahead and try to answer.
Can I intervene just one moment?
Yep.
Is I can tell you that, and perhaps there was a misunderstanding with some folks last year, this discussion of services has always been a part of it.
Okay.
Just so you know that.
Yeah.
I don't want to put everything on Andy's shoulders, because I have to say that Andy and his staff has been great to take and work with, and we've even had a couple of our telecoms that have stepped up to, have good discussion with us. So this isn't all on him.
Okay.
So if you got some really tough questions, I'm willing to.
Well, it was under my understanding, I may be wrong, that, it would be used to operate the crisis center, and then we'd utilize the professional services that were needed, maybe after the call, by some other source of funding. But now you're saying that that's not totally correct?
Well, and every time I speak, Andy, correct me if I'm wrong on this, but we are required to provide services to anyone that calls 988, period. It's not up for discussion.
Okay.
Whereas today, we kind of maybe when someone calls 911, but there's no guarantee on that. This here is providing a guarantee. And then I think the second step to this is that we are also required to follow up with everyone that calls 988 to see if they got the services, how's it working, is there other things that need to be done? Is that correct?
Yes, right. And I did bring with me that list from last year that you were referring to. So last year we had 1 million of this 17.5 going to 988 promotion statewide to have a campaign to help promote the use of 988 instead of 911 by the public. We had $3 million that was going to 988 call centers. That number I need to increase now to 6 million based on our estimates. Care transition, we had 500,000 for care transition, which is really to help provide those follow-up services that Representative was just speaking of. That allows us to stay in contact with recently discharged state hospital patients and also establish outpatient behavioral health services, as well as outbound call operations for the call centers. We had 5.5 million allocated for mobile crisis. That was required all funds for statewide coverage of 8.2 million for the SMI population and 2.8 million for the IDD for a total of 11 million. There is an enhanced FMAP that will be available starting on April 1st through CMS for our CAN-CARE recipients. So we believe that the 5.5 would be enough for us to leverage that enhanced 85% FMAP to meet that dollar amount. We also requested $4 million to go to crisis stabilization to expand our current crisis stabilization services. There are a lot of communities around the state that still do not have a crisis stabilization unit available. This would allow us to fund additional ones. You'd be familiar with those because we're currently funding a number of them through our lottery vending machine funds at KDADS. And then we had 1.9 million for crisis residential services. These are services that distinguish themselves from other levels of care due to their home-like environment. They blend psychosocial models of care, multi-day lengths of stay, and provide operational support that would cover the cost of services to the uninsured and expand crisis services to rural communities further. And then lastly, we had 1.5 million that was allocated to a suicide prevention program. The governor has included that 1.5 million in her budget request through a state agency enhancement. So that'll be, that 1.5 million could be potentially removed from this.
Further questions?
One more.
One more for Representative Blex, and then I believe Representative Berquist.
Thank you, Madam Chair, and thank you for that. Just and you're well above 17 million that's expected at 50 cents per phone, sounds like to me. What do you anticipate a charge per phone would need to be made to cover what you just listed? Is that going to be $1 per phone, or is it going to be $2, or it's getting, seems like a lot further from the 50 cents per phone. Am I thinking right?
I don't believe so.
Okay. All right, thank you for
Some of
that.
those numbers are referring to all fund numbers as opposed to just the fee fund.
Okay, thank you.
Representative Berquist.
Thank you, Madam Chair. So before 988 and before the federal funding you're anticipating, what was the funding level statewide for this service of suicide prevention? How many millions was there being spent, or is there being spent up to this point and before 988 and the federal funding?
Yeah, so the answer for how much money was going to the National Suicide Prevention Lifeline is probably around 120,000. And 4 or 5 years ago, it was zero.
Okay, follow up. It seemed like last year we talked about that approximately $1 million was being spent, and that's not correct.
Yeah, right now, this year, we're spending 3 million SGF that's gone out to the 3 different contact centers based on enhancements that were put in the budget last year.
I think where he's at, Andy, is what were we doing prior, what is the system today with no 988? And how is that funded? Forget 988 being on the table.
Yeah, so right now, if we looked back at 2020, right, that's going far enough back. So in 2020, we had a small grant from Vibrant that was not state money, that was being allocated to increase our in-state answer rate. And so those funds were passing through from that funder through KDADS and then going to Kansas Suicide Prevention Headquarters to answer National Suicide Prevention Lifeline calls. There was also about, I believe, $60,000 that was being split between suicide prevention efforts and answering the NSPL. And that's where we were in 2020.
Thank you, Madam Chair, and thank you, sir.
Representative Lynn.
Thank you, Madam Chair. This question might be better for the telecom providers. Will we be
They're
here?
not on today.
Okay. I was just wondering if for those, if this is going to be billed based on the area code or if it's based on a mailing address. I know we have a lot of 816 in our area that live actually in Kansas.
It's billed on the phone itself.
It's billed on the phone itself.
Yes, per phone line and disposable phones and cell
So if
phones.
somebody were to have a 913 and move out of state, it would still be billed to them?
The area code's
Yeah,
irrelevant.
let me try to respond if I can. So the fee is allocated to the customer of the telecom, right? So it goes on their bill. So if they have a bill for a Kansas number, it would be allocated to them based on their address, I believe, for their billing address.
Okay, based on the address. Okay, thank you.
Representative Epley.
Thank you, Madam Chair. And I didn't know, did we want to introduce our new member that's on the committee today?
Yeah.
Can we do that?
Oh, that would be awesome.
We do have
Vice Chair.
we do have a brand new member on our committee today, and I want to take this opportunity to introduce Dr. Clifford, who is with us from Western Finney County and brand new on the committee, and glad to have him aboard. So he's a new face. We've got several new faces too, but he's brand new to the legislature.
We
So,
also have Heather Myers, which is online.
and we also have Heather Myers, which is online, and we have some other new members present also. And maybe at the end of the committee we can go through and do introductions. But digressing, I just wanted to comment. You commented that with the 3 centers, the cost is going to go up to maybe $6 million. Did I understand that correctly? As of right now, that's how it appears. And so when you look at the community support and clinical services, which boil down into case management, crisis diversion services, is that going to be covered by other parts of the KDAD's budget, or is that going to be covered by these funds that we raise potentially from telecommunications or from SGF or whatever? Do we know, I mean, that seems like an unknown quantity at this point. I just wondered if we have any idea how much those are going to cost. I mean, those teams, I think, could, especially with inflation just in the last year, I feel not as sure about the cost on that as we did even a year ago when we were talking about this, Andy, and didn't know if you could comment about that, the number of teams, and what we're looking at through these 3 centers. Thank you.
Keep in mind, we're looking at not only the crisis mobile units, but IDD mobile units
Yeah.
as well.
Yeah. And so I'll take a crack at it. And so our plan for these funds is to provide services to people that have called 988. And in order to do that, we want to make sure that we're expanding these services into areas that don't currently have them, right? And so as we're building mobile crisis teams and putting together crisis stabilization units in communities that don't currently have those, these would be funds that we would be able to use to help start those. Once they're started, we would then be able to use CCBHC billing models and PPS to cover those. So it's really about expanding the services. Once the services are established, they'd be fairly self-sufficient.
So just to clarify, and I'll be done, this is really more or less like seed money to get these going and started. And with the new model of mental health billing that's going forward now, you think they will become at some point self-sustaining and not lean on ongoing budgetary needs?
Correct.
Thank you very much.
Representative Rees.
Thank you, Madam Chair. I'm just curious about if we're going to prioritize any parts of Kansas, for like more of the rural areas, who obviously have to travel much further to get to like crisis centers. Or will they be prioritized first?
Yeah, I think the simple answer to that is yes. But what we are going to do is really kind of conduct a survey of what services are available in which communities, and then identify which ones already have a mobile crisis team or a co-responder model where somebody responds with the sheriff, or if they have a crisis stabilization unit or not that serves their area. So we know that the lottery vending machine money has really allowed us to expand those crisis services into rural areas in a fairly significant way. And I think this is a real good opportunity for us to be able to further expand those crisis services into those rural areas and get them established.
Thank you, Madam Chair.
Well, and Andy, isn't there a criteria that's set out there that we have to have those available within, what, an hour?
Yeah, I think right now we're
Longest.
Yeah, so we've got the 1 hour response time. That's the standard, and we're looking at some additional models where sometimes they will allow for a 2 hour response depending on certain factors revolving around the population counts. So we might end up with something that's 1 hour in the majority of Kansas and 2 hours in places like the far northeast corner or the far southeast corner.
And I think committee, some further clarification, because I know there's been a lot of confusion. I'm kind of bringing things to you of the questions that I've been asked and I've been hit with, is, why can't we use our law enforcement and our fire department people, all the people we have out there? Well, we are. It's just that instead of having dedicated, specific people sitting somewhere in a brick and mortar building waiting for one of these calls, these individuals have day jobs within all those areas that are going to be required. So it's kind of like a volunteer fire department. When a fire breaks out in one of those areas, the call goes out to the pagers or whatever their communication device is. Those people get together, boom, they're out there on the scene. So that's kind of how this works. So it's not like we're hiring groups of people. We're going to have them sitting out there waiting in buildings, if that helps clarify a little bit. Representative Turner?
Thank you, Madam Chair, and thank you for your presentation. It's informative, and I'm trying to go back to last year when we talked about this, and some of it's coming back and some is not. So just to take a step back and kind of put things in context, so this 988 number came in order to improve, like you said, public's knowledge, a quick number to call, get appropriate care to these folks in a quick manner. So you read some language there in terms of what was actually associated with providing this. You said it's spend the money on mental health care for those that call 988. How far does that go? Is there a limit? Is it just to deal with the call, to get it dispatched? To, you know, how far do we go? Because that's a fairly open-ended statement, it seems, and I'm just trying to understand where that boundary, or if there is a boundary, because we could spend lots of money all the way downstream.
Yeah, well, and so I think that the appropriate boundary is probably in as needed to resolve that crisis, right? So we're not talking about their lifelong care just because they called 988. What we're talking about is, I'm in crisis now, I need a level of treatment, and that level of treatment might be more than just a phone call, right? That level of treatment might be a mobile crisis team coming out and sitting in their living room for an hour and a half, talking them down. It might be, a 24-hour stay in a crisis stabilization unit where they can get sober and, have some counseling done. It might be, a 2 or 3 hour stay or 2 or 3 day stay in a residential program where they can establish a routine and a medication regimen. But the point would be is that you're resolving that immediate crisis and then connecting them to our regular outpatient services that already exist so that they can maintain those services in the community. Does that make sense?
Yes, can I have a follow-up, Madam Chair? So is any of that, like providing mobile crisis centers, is any of that put in the regulation to impose the 988, or is that up to the state to define how they go about dealing with that crisis?
Well, what the federal language that I put in here is from the authorization to collect and use the fee, right? So that section doesn't outline what those services are. Like, there's not a service definition, right? But we do at the state of Kansas have service definitions for those services and regulations that are in our statutes for crisis intervention centers and things like that. So we as a state have definitions and regulations that apply to these services, but we're not imposed at the federal level upon that.
One last one. So as we've developed.
And you've reached your
I know.
session limit.
I'm right on the edge of it right now. I got it. I'm done for the year, right? No, I mean, as you said, some states are ahead of us on this. Have you looked to other states and have you kind of fashioned this, or are we starting with a blank page? I'm just wondering if we've looked at best practices and kind of what's worked and what hasn't.
Yeah, the legislation that we submitted was model legislation. So it's tweaked for Kansas. And it has been, we did a lot of debate on it last year, and I think we've, really had some good input in it in this committee. And then in the current committee, I don't think it's had a hearing yet, but it's, I think, a real good opportunity for us to make it our legislation, right? I don't think there's anything in there that needs to be modeled after California or modeled after New York. But it is the result of work that we have done working with consultants, working with subject matter experts at the national level, and it's reflective of the guidance that we're receiving from CMS and from SAMHSA. So I feel like it's very informed.
Thank you. Thank you, Madam Chair.
Are you sure? I'm just checking with you, Representative. Representative Wolf Moore?
Thank you, Madam Chair. And thank you for your presentation. And first time I've heard it because I'm new to this committee, so I apologize if my questions are elementary to the other members. But so I think you said in your presentation that would this also be a service that could be used by patients who turn out to be involuntary? I mean, is there a path for involuntary patients also?
Yeah. So any time that a call is placed to the National Suicide Prevention Lifeline, if the person on the other end isn't safe, if there's an imminent risk to themselves or to others, law enforcement can be dispatched. And then in the state of Kansas, law enforcement has the ability to take them into protective custody involuntarily. So it absolutely has a pathway for involuntary admissions.
And then my follow-up question, I appreciate knowing that, is that I know we're working on the rules and regs for the 72-hour hold. It seems like if this is successful, we're going to be treating more patients, which is absolutely what we need to do and the right thing to do. Do you know how many facilities at around the state, once we get those rules and regs, that 72-hour hold bed is going to be available?
I can't answer with I can't answer with a licensed number because we haven't licensed anybody yet, but we're anticipating that there will be a fairly significant number of those beds available in the urban areas. So in Kansas City, Wichita, Topeka, and Lawrence, we're expecting to have CIC licensed facilities. And I would guess the total number of beds between those communities would probably be close to 200. So,
extremely helpful.
but
That's assuming we can
that's
find
an estimate
those
at the moment.
beds.
Right.
They're not there today.
Right.
That's our hope.
Yep.
Thank you very much, Madam Chair. Thank you.
Representative Berquist.
Thank you for another opportunity, Madam Chair. The funding you mentioned from the lottery vending, can you tell me how much money that is that comes in, and whether it's very specific what it can be used for?
Yeah, I'd be happy to. So the lottery vending machine money that we receive at ks is set aside for two specific purposes. One is to expand and fund crisis stabilization units. And the second is to fund clubhouses. And so the way those funds are allocated to us, I believe there is a cap of $8 million. 25% of that, or $2 million, is what's allocated for the clubhouses, and $6 million is what's allocated for the crisis centers.
That's good. Thank you.
That was done very intently and carefully. And I see a reviser laughing at me, but that's okay. Committee, are there further questions? As you have questions come up, if you want to take and get them to Dave. And because this is, we're going to work on this, and it's our goal to get this out as soon as we can so that the Senate can take a look at this year. We have to have something when that switch goes on July 16. And so we don't have a choice. We don't have an option. We really hope that we would work on it next year. I will be working in the meantime with the agency as well as with the telecoms, because we were making some movement last year on making some changes and tweaks, but we just kind of ran out of time. And hopefully then by the time that we're prepared to meet again, we will have some of those changes available to present in the existing bill that we have. And my goal would be to get it out here in January, but I don't get to control everything as much as I like to. So are there any other questions on this? Representative Turner.
Thank you, Madam Chair. I guess I wonder, I haven't looked at the implementation plan that he said is out there, 60-page plan. Is it developed assuming a level of funding at 50 cents, or is it ratcheted such that it's adjustable for other levels of funding? If the answer to the first one is yes, it's 50 cents. Thank you.
Well, what I would say is that the plan outlines what we think we need to meet the demand or the anticipated demand for services. So it doesn't specifically say like we're going to do this or not do that based on whether or not this bill gets X amount of funding. As Representative Landwehr mentioned earlier, like we're obligated to do this and we're going to have to find a way to do it. My preference is that we do that through a dedicated funding source. But if that's not possible, we'll find other ways to get it done because we have to.
Other ways meaning SGF? Because there's not another funding source out there I'm aware of unless you are Representative Wolfmore. All right, Andy, thank you very much for being here today. And if you'll get that breakout of that today so he can get it out to the committee members, I think that's something important for us to have as we work through this. And then I will be in contact with you and the telecoms, and we'll sit down and see what we can take and hammer out. I think we just got some finishing touches, actually, so I'm kind of pleased with that. So thank you for being here today. My vice chair is always an eager overachiever, which I truly appreciate. So we do want to welcome Representative Clifford to our committee. We also want to welcome Representative Kathy Wolfmore. And I believe it's Representative Heather Myers, I believe, that's on remote with us, and she was Brett Parker's replacement? Yes. Is that correct? Mm-hmm. And you'll notice I have a new person sitting to my right, and it's not Brett. Happens to be Representative Reese. So this will be your crew, and I think, Rida, I'm one of these days, no, it's not going to happen. I'll get your name down. I try really hard. Is with us again. We have a new research person with us, and that is?
Hi, I'm Leanne Thone. This is my first session, so please go easy on me.
Oh, now you just set yourself up. Yeah, it's all over. You should have never said that. No. And then we do have Revisor Scott Abbott back with us to assist us. So the next week we have tentatively set up for Tuesday what were we doing, Dave? We were having the long-term care ombudsman's going to come in and kind of update us on what some of us heard during the interims. And then we will also try to get the new secretary of KDHE just to come in and introduce herself, and let's get familiar with her a little bit. So, and the rest of the week right now stands just on call. So committee, wait a minute. My rules didn't change. Okay, yeah, no, the rules are two sessions. Yeah, two sessions. Are there any bill introductions? No? Okay, thank you. No. Does anyone have bill introductions? No bill introductions after all that? Oh, come on. All right. Adjourn.